Thanks for joining us on this Sunday night. I'm Corey Stark. The impact of the coronavirus outbreak is growing across the St. Louis region as more people are getting sick and new restrictions go into effect to try to stop the spread of the virus. Here are the latest developments tonight. The St. Louis area has reported 8 new COVID-19 deaths since yesterday, including the first deadly case in Franklin County, Missouri, and Montgomery County, Illinois. A school bus driver who had been delivering meals in the Ferguson-Florissant School District died this weekend from the coronavirus. And St. Louis stores are making some major changes because of Missouri's statewide stay-at-home order. As we mentioned, there are currently hundreds of people in the St. Louis area hospitalized with COVID-19. The St. Louis Pandemic Task Force says we are still several weeks away from our peak, and those hospitalization numbers are expected to increase. News 4's Alexis Zotis is asking the task force about those numbers. She's getting some answers about wearing cloth masks. And Alexis joins us live from SSM Health St. Louis University Hospital. Alexis, what did you learn tonight?
Corey, the big takeaway from the task force's presentation today is that there is still time to help ensure hospitals like St. Louis University here are not overwhelmed with patients. And it really comes down to following those guidelines, staying at home, social distancing. And if you're wearing a cloth mask like recommended by the CDC, we've got some important information on how to do it correctly. Abby Eilerman is no stranger to sewing and is putting her skills to good use.
I started doing it Friday, and I'm definitely over 100 masks.
She owns Daily Disco, an embroidery company in the Hill neighborhood. An Instagram post on Friday led to a flood of requests.
The response was crazy, so I've been trying to make as many as I can and also encouraging other people who know how to sew to make them too.
The CDC says wearing a cloth mask that covers your nose and your mouth, especially at busy places like the grocery store, can help slow the spread of COVID-19.
Anything that we can do to decrease spread is a good thing.
Dr. Alex Garza is the head of the St. Louis Metropolitan Pandemic Task Force. He presented the latest numbers Sunday afternoon. Right now, there are 468 people hospitalized, 164 in the ICU at the hospital systems represented by the task force, SSM, BJC, Mercy, and St. Luke's.
These numbers track pretty closely to what we're seeing as a nation, which is about 30% of patients that are admitted to the hospital are going to need some sort of intensive care. And of those in intensive care, around 70% are going to need ventilators.
The peak is predicted in our area in about 2 to 3 weeks. They expect the hospitalizations to rise to 1,300. Worst case scenario could see that number peak at 3,300. He says while you might have heard it hundreds of times, social distancing and staying home is the way to keep that number from reaching the worst case scenario.
We know if we're pushed to that level, it's going to put a strain on our resources.
If you do go out in public and wear a cloth mask, it's important to ensure you keep it clean and don't let it lull you into a false sense of security.
You still have to maintain that social distancing, still have to wash hands, keep surfaces clean, don't touch your face, all of those other things. So it's just another sort of added layer, but it doesn't relieve you of all of those other things.
As we see more and more people wearing these cloth masks out and about, we have seen some people doing them incorrectly. First off, it needs to cover your mouth and your nose to be effective. When you take it off, remove it just with the loops or the ties. You need to wash your hands immediately afterwards, and you need to wash these frequently in hot, soapy water. Reporting live, Alexis Zotos, News 4.